Meanwhile, Victorian health authorities have alerted 70 patients of the status of a Melbourne doctor who treated them whilst carrying the coronavirus. Dr Chris Higgins, who just happens to be the father of singer Missy Higgins, returned from the US on February 29 this year with flu-like symptoms. He went to work thinking he was recovering, not thinking he was infected by the coronavirus. Since then, the health minister in Victoria said she was flabbergasted at Dr Higgins's actions, but he's hit back on Facebook saying he thought the minister was taking a cheap opportunity for political grandstanding and would appreciate an apology. Well, there was a response from the minister today, but there was no apology. Meanwhile, the Australian Medical Association is going into bat for Dr Higgins, and I caught up with its president just before coming to air this afternoon. Tony Bartone, thank you very much for your time.
My pleasure.
Before we get to the case of Dr Chris Higgins, I wanted to ask you about this information I heard from a family member of another resident in this nursing home where we've lost two Australians, elderly Australians. They're upset that their grandmother or grandfather, they haven't told me which sex, wasn't being tested for the coronavirus. They are in the same facility. Does that seem odd to you?
Look, there's a clear case definition about who is to be tested and who isn't. It's about ensuring that we do follow the guidelines, but anyone with symptoms and a close contact would seem to fall into that case mix or case definition. And of course, this nursing home is quite a large one, and unless there was close contact, it would either with the person, unfortunately, one of the two people that have passed away, or with a carer that was caring for those residents conjointly. There may not be the need for testing. So she should obviously talk to the doctor looking after her, and that would quickly address the situation in cohort with the health authorities in New South Wales.
OK, let's get to the Dr Chris Higgins case. Why didn't he take a test for the coronavirus when he returned from America on February the 29th?
Well, look, even today, as I sit before you, there is no requirement for any, or even guidelines, I should say, that would suggest that anyone returning from the USA does need to be tested for the coronavirus, for COVID-19, given the symptoms that he had. Now, he doesn't fall into the case definition as we currently look at on the advice that is on the as of the Health Protection Principles Committee. That information is updated regularly, but even today, the information, America does not fall into either a high risk or a moderate risk country. Clearly, if the authorities do want us to test people returning from overseas, and if they do want us to change the guidelines, that's fine. But communicate it with us and let us know. But let's be clear about applying the information consistently and in collaboration with the profession, and not retrospectively.
OK, let's put that aside for a second and what the rules are. But here is a doctor, he's got some symptoms of a cold, which we found out later on was the coronavirus. On that day, February 29, America lost its first patient to the coronavirus, who also announced the highest level of alert. Shouldn't he have been taking precautions and got tested anyway?
Every day we follow the advice and the guidelines of our Chief Medical Officer and obviously of the Health Protection Principles Committee that puts that advice out. That's the single source of truth. And as doctors, we follow those guidelines to ensure that we're maintaining the best coordinated response during a time where obviously the community is extremely worried and concerned.
OK, and what's your reaction to the health minister?
We can't deviate from that.
What's your reaction, therefore, to the health minister in Victoria saying she was flabbergasted by Dr Higgins' actions?
We're clearly disappointed with that, the minister's reaction and comments in that respect. We're clearly following the advice of the authorities, and we clearly need to work collaboratively and in concert with one another. We can't have any differences in a messaging or in opinion being influencing on the guidelines. The guidelines are there in place for a reason, and we follow them to the letter of the law to ensure we protect our patients, our community, and indeed all the other healthcare workers in the front line.
Should the minister apologise?
I believe she should.
What about the Federal Health Minister? Today I heard Greg Hunt say, if you've got a runny nose, you should just stay at home. Your thoughts on that?
Well, look, clearly, if anyone is particularly unwell, they should stay away from work. Doesn't matter who they are in the community. I think during this evolving epidemic, we all owe an important principle of respecting each another's right to a healthy work environment. But clearly, if we look at the detail released by this doctor, his symptoms had largely resolved before he attended work on Monday, back on the first day back. So that's the important piece of message that was lost in all of this, that the doctor's symptoms had largely resolved according to his own words. And that clearly was the information that had somehow got lost in translation between the notification and the messaging yesterday.
So does that mean we won't have any other contraction of the coronavirus from the 70 patients that he dealt with?
Look, what I can say is that we're learning a lot about the virus every day. And all those patients have been contacted and will be followed up appropriately. That's one of the things that we do really well in this country, and that's why we've been able to contain the virus to the spread that it is only so far yet in the community. And part of that is the protection and being able to identify. Now, and I do feel for those patients, obviously, but if you I heard some of those patients on radio, on Talkback today, and they really do have a very long-standing relationship with the doctor and were indeed not at all concerned, and they will be followed up. And that's the important thing of this. We will take all measures to follow them up and protect them as best we can.
Okay.
But the doctor was following clear guidelines at the time. They did everything that's required back then on the 2nd of March, and indeed today nothing has changed in that respect.
Tony Bartone, thank you very much for your time.